So our project here at NHS Tayside aims to transform quality of life for men diagnosed and their families by metastatic prostate cancer. We recognise that there's huge decrements in patients and their families' quality of life for men affected by this disease, but also the treatments associated with it. So the aim of this project post aims to transform the care delivery to really optimise best supportive care, to then drive forward improvements in patients' quality of life and also their ability to effectively self-manage for their condition, but also to allow us to transition care closer to the community care setting. So what we developed was actually an advanced prostate cancer clinic that is part of my project post. I run that service as a part of the wider multidisciplinary team, as it's important to recognise that as a senior specialist prostate cancer nurse we don't work in isolation. So that was the first thing. So in order for us to then link the care closer to home, we then set up additional services in our remote hospital. So we looked to set up clinics not just in the main centre here within 9 Miles Hospital, but also in Arbroath, Stracathro in Perth, to allow patients that are having that huge distance just coming back to 9 Miles Hospital. The other aspect that we also looked to do was to implement patient-reported outcomes in routine clinical practice, because I think all healthcare professionals, without a question, would always aim to strive to ensure that we're delivering holistic care. But sometimes that can be very difficult to do if patients are particularly reticent to speak about issues that are embarrassing, or they maybe not feel that they have the opportunity to. So part of implementing patient-reported outcome measures such as holistic needs assessment in our routine clinical practice allows patients to have that verbalisation without necessarily not always having to articulate it. So therefore, when gentlemen and their families come to clinic, in the advanced prostate cancer clinic, we can then tailor that consultation to the areas of most need to therefore aim to optimise quality of life. Alongside that pathway of care, what we've also introduced is health and wellbeing days that allows not only gentlemen to meet with other people who are affected by prostate cancer, but it allows evidence-based presentation to be delivered about how you manage symptoms, what are the consequences of treatment, but also importantly, what are the resources available closer to home in the community setting.
The post itself has had a great impact on our patient group because we can now provide clinics to give support and work a lot more collaboratively with GPs through education and also through our clinics as well.
Certainly from anecdotal experience in clinical practice, undoubtedly I think it's had a huge transformation on patients' quality of life, having that resource that they can come back to at any which point. So I think the overall drive of this project, I think it really helps to optimise care closer to home, and also with what existing services are there to then improve quality of life, also their self-management as well, but also recognising that it's not just the man, but it's really about optimising quality of life for the family unit as well.
So with the prostate cancer support for Catherine's job in the last 2 years, we have made a significant impact on the people's lives in Tayside. And this certainly is something which needs to be continued in future, because we can't afford to lose that.
So I think it is an excellent project, and I would recommend it because it helps with this isolation. The very fact that there's other men involved, it helps with isolation, and it gives you something to measure progress against, as opposed to deterioration, which becomes all too obvious. I would recommend it. I have recommended it to my friend.